Well, good afternoon, everyone. Welcome. My name is Kelly Romanoff. I am the co-chair of the steering committee, along with Ms. Tanika Conaway. I'm with the Charles and Marjorie Barancik Foundation, and we are so pleased to be part of the First 1000 Days Initiative since it was first an idea back in 2016, and my, has it grown, and it's grown so much because of each of you and your partnership and the leadership of the incredible team of the First 1000 Days with the support of Sarasota Memorial Hospital. So we're here today to develop a strategic plan that will carry this work into the years to come. You can see our agenda here. We're going to spend a few time just orienting to First 1000 Days. Some of you are very familiar and could do this presentation in your sleep, and others are newer to the initiative. So we just wanted to spend a few minutes grounding ourselves in the history of First 1000 Days, who we are and why we are. And then we'll be looking at a series of community needs and partnership opportunities, talk about building futures with parents and their dreams, and then move into breakout groups where we'll spend some time looking at the matrix that was put together based upon your input on the landscape analysis around the key indicators. So when you all move into your breakout rooms, that is where you will end your time with us. So we plan to be about 2 hours here, and just really encourage everybody to be as present and participatory as possible. A few housekeeping notes. This all will be recorded. Please keep yourself on mute so we minimize background noise. The chat room is being monitored, so if there's anything you want to say in the chat, please put your information there. I would like to note our fearless leader, Dr. Chelsea Arnold, is unfortunately ill and unable to be with us today, but just wanted to thank her and the entire First 1000 Days team for preparing this meeting and all the content for us. So I know several people could not be with us. Unfortunately, Chelsea one of them, but we'll be taking notes and getting this all out to others. Next slide, please, Janice.
Oops.
So as I mentioned, First 1000 Days has been around for many years and is generously supported by individuals and institutions. And representing one of those foundations, I know that part of the reason that we invest in First 1000 Days, it's not only the mission of the work, but it's you. It's this collective work that you all as partners are doing. And we just truly believe that each of you is bringing something unique and a strength to this work that makes the result better than any one institution could do together. So thank you for your involvement. And I know these donors are just incredibly pleased with you and the work that is coming out of this initiative. Next slide. So many years ago, we were talking to a nurse at Sarasota Memorial Hospital and just saying, like, so what happens? They come in, they have these babies, and what do you do if you see a family that's in need, or you see that a family's struggling? What happens? And the nurse said, well, we send them home on a hope and a prayer. And we thought, well, let's keep up hope and let's keep prayer in the picture, but let's think about how we as a system can come together and build around the families. Because as we look at the next slide, we also learned in talking to the hospital that this over half of the babies born were on Medicaid or uninsured births, indicating a degree of poverty and a degree of hardship. And we've all said it's really hard raising a baby. It's really hard living in poverty. And when you put the two together, it's even harder. And so we thought, as a community, what can we do to organize around these families and give them what they need during their child's critical development years? And on the next slide, you'll see we asked this simple question, like, well, do all the services that a family would need exist in our community? And by and large, we found that the answer is yes. You all have wonderful programs and services, but the families felt like it was a maze. They didn't know who to turn to. They were very confused about eligibility requirements. And we realized that although we had a very abundant array and system of support, navigating that was an extreme challenge. So that's where First 1000 Days came in, at this systems level thinking about how you all partner and we come collectively around families to try to streamline access and communicate better so that it's not a maze anymore. And the mission and vision that guide us are rooted in the family, you know, that mother, that father, that caregiver, that baby, that we want to support them and connect them during those pregnancy and critical years, and that we want an opportunity where everybody is healthy, resilient, and can reach their dreams. And I just really commend you all in the First 1,000 Days teams for putting parents first. You know, we think about this very much as our work as professionals, but also incredibly as parents. And I just, is Tanika, my fearless co-chair of the steering committee, on the call with us today? I don't think she was here. I was going to spend a few minutes for Tanika to introduce herself. She's a beautiful mother that we met through this work and has just gotten involved because of that parent empowerment piece and wanting to help more parents. So we thank you for the work you do and spending time with us today. And I'll be turning it over to Janice Houchins, who I know many of you have had the pleasure of meeting, and Janice is going to lead us through a few more introductory slides.
Thank you, Kelly. Yes, and thank you everybody for being here today. Just wanted to share quickly our 3 core components of First 1,000 Days. The first is care coordination. We really want to make sure that parents are getting connected to the resources in the community so that their basic needs are met and so that we can reduce their stress levels, improve and increase the number of healthy days, both physical health and mental health, that parents have so that they really have that opportunity to have more time and can focus more on their children and really help their development and growth. The other component is parent empowerment. We really want to help and support parents so that they can be leaders, not only within their own family unit, but also out in the community. And then the third core component is targeted interventions. So what we do is we look at Unite Us data, we look at other data from community partners, we talk to parents, we listen to what they need, what the barriers are that they face every day, and then we work collaboratively with community partners to really find innovative solutions that can meet the identified needs and barriers. So here is a slide representing data from the first quarter of calendar year 2024. I'm really excited to show that the network and Unite Us is growing exponentially. I'm really excited about that. And Unite Us has been an extremely valuable tool that we've been able to use to refer individuals to for community supports and services. It really is able to show us a family's journey on what their needs and the services and the supports that they're getting connected to out in the community. And it also gives us a really unique perspective where we can see what the capacity issues are. We can see what the gaps are. We can see what the needs are. And then as a community, try to, again, figure out how we can meet those needs. So here to the left of your screen, in this first quarter of this year are the major needs that have been identified, the majority of referrals that have been sent. Housing, of course, is a huge issue. Unfortunately, there's limited amount of housing resources in Unite Us in which we're able to get families connected to. But food, benefit navigation assistance, job, employment searches, and infant supplies are really key critical needs that families are reaching out to us for. On the right-hand side of the screen are co-occurring services. So we have a care coordination committee that meets on a regular basis. And we really look closely at this Unite Us data so that we can find where those co-occurring needs are. So for example, when people are reaching out for food, they oftentimes are also needing rental assistance. That's just an example. Another example is we know transportation is a really big barrier in our community. So anytime we can connect families with multiple supports, one stop, it's really going to eliminate and reduce barriers that family face in getting the type of supports that they need. Parent empowerment, of course, is one of our core components, and parent voice is truly at the heart of the work that we do. It is core and center. We want to hear from families what their needs and what their hopes and dreams are, what the barriers that they're experiencing on a daily basis. So in order to listen, we every other year conduct parent focus groups, and we just finished them for 2024. And there were 11 different organizational hosts that held 1-hour sessions, gave a space to hold 1-hour sessions. We interviewed 100 parents, and we got some really, really good feedback. Parents were given a gift card to express our sincere appreciation because we really do want to hear from them what it is that they're experiencing. Some of the major barriers that we heard this year, I don't think are going to be any surprise. We had housing, citizenship, childcare, employment, all like kind of in that financial arena, legal issues. We heard transportation is a challenge, as well as access to prenatal care. One mother, there's a quote here from a mom in Arcadia, and she said, "We don't have a doctor for pregnant women, and our local hospital don't deliver babies. So we have to go out of town for delivery and monthly visits. And that means we have to pay somebody to take us, and they charge too much." So you can see multiple needs identified in that one comment from one parent. This is just an example of the incredibly rich feedback that we have received from parents. We've typed all of that up and are happy to share that with our community partners. Some of the other ideas that parents wanted, they thought it would be brilliant to have childcare available right on a work site. That would just reduce, barriers, many different barriers in one. And another thing that I personally loved to hear was that they really wanted more support and programming for fathers, more activities for fathers to do with their children, more education for fathers about being a dad and the incredible role that they play. We also asked them what their dreams are, not only for themselves, but for their children. And you can see for themselves, many wanted to learn English. They wanted to start their own business, go back to school or go to school, get a job that was going to be able to support their family. Housing, owning their own home was incredibly important. Many said they just want to live somewhere where they feel safe, where their kids can go outside and play, and they're not worried about the unsafeness of their neighborhood. A lot of them said that they had gotten themselves into a financial hole. Their credit was bad, which just really plays into not being able to get housing. I mean, it's just a ripple effect. And so they wanted to get their credit fixed. And citizenship, again, came up over and over. For their children, they wanted them to do better than they. They wanted them to be better educated, to follow in a happy and safe and healthy path. Wanted them to be independent, happy, confident, successful, and have a good connection with their dad. So I'm now going to turn it over to Tina Wilson. She is our family navigator that is working directly with families and is a huge blessing, not only to our team, but for the families that they serve. So Tina.
Thank you, Janice. Like Janice said, my name is Tina Wilson. I'm the family navigator for the first 1,000 days. We are still seeing that navigating the system is a huge need. Parents not knowing where to start, who to talk to, especially if they do not have citizenship as well. As Janice mentioned, citizenship is a huge need around here, kind of trying deciphering where they should go. And also we're just seeing that mothers, fathers, grandparents really need a community for them to raise their family, meaning they need help with finding prenatal care, establishing good prenatal care, Reliable transportation is a huge need, especially the bus systems. Baby supplies, diapers, and wipes, kind of a no strings attached. They don't always have time to go to these classes and things like that. And WIC doesn't assist with pull-ups, so when they're in their potty training era, they're having a hard time meeting those needs. Reliable and affordable childcare. As we know, childcare is hard, and the kids get sick, so kind of going in and out of taking PTO, calling in sick for work, then maybe losing your job and trying to find reliable childcare again. And then also financial assistance that Janice touched on, as well as budgeting and helping understand debt. A lot of families get in this transition where they're living from paycheck to paycheck and having a hard time making ends meet. And so just really getting some assistance as well as education for this. This is a family that we've assisted. Her name is Katty. She was supposed to be on the call, but I don't think she was able to log on today. Her quote was, "You have no idea how much you've helped my family. I know when things get rough, you always help me. You have blessed me with education and assistance. Thank you for loving my family." We met Katty just when her little daughter, Mia, was born about 3 years ago. Since then, she has gotten a job, learned English, and she's been part of our parent advisory committee. She used to just be a participant in our parent advisory committee, but now she helps lead our Spanish parent advisory committee. She's a wealth of knowledge and is always willing to help out another mom in need, another family in need, by giving them a helping hand. And we just really admire, how far she's come and how far she still has yet to go. Thank you, Janice.
Okay, let me advance to the next slide. All right, so hopefully many of you on the phone call or on the webinar today had a chance to help us celebrate our partnerships, our accomplishments, and really look at the work that we wanted to do moving forward at the event that we had in October. But at that event, we had professionals and parents there, and we really revisited our mission and our vision statement, and then identified these 4 key indicators that we want to make an impact on long-term: prenatal care, severe maternal morbidity, infant mortality, and child removals. And so what we did in preparation of this webinar was we sent out a survey to you all. And in that survey, whoops, let me go back here. In that survey, we had, let me go back here. Can somebody pull up the matrix? I thought I had that up.
I can share my screen if you want.
Okay, the matrix. Okay, thank you, Mary. So based on that survey that was sent out, we ask you all of the indicators to identify what services and supports that your organization provides and what they are, and the specific barriers that you are seeing in each of the indicators. So I'm just going to run through this. The information that is on this chart truly was just a cut and paste of the survey responses that we received. After we run through these, just to familiarize all of you with the responses, we're going to go into breakout sessions by county, where you will have an opportunity to share data that may be missing, have some conversation. And then again, we'll send a survey out after this event so that you can fill in anything that you want to add. So there's plenty of, I guess the message here is there's plenty of opportunity to give feedback. This truly is just an initial draft. We will be growing it and building it. And so that's why we need you here today for this input. But let's just start walking through prenatal care. Barriers. First one being transportation. There was reports that transportation was unreliable, or it was limited, or it didn't exist at all in some communities. To remedy that, some organizations like Whole Child Manatee have gas gift cards, Uber rides. Step Up Suncoast will assist helping mothers get to appointments. A barrier of health insurance, Medicaid, that was a barrier, difficulty getting Medicaid, and then changing Medicaid to the right plan that best fits the client. We do have folks that offer benefit navigation assistance, and we do have pregnancy Medicaid enrollment. Access to care as a barrier, finding that OB providers may only take certain Medicaid insurances, or they may have a limit. So sometimes it's difficult finding a doctor that takes your insurance and then being able to get in to get an appointment. Another barrier identified regarding access was that pregnancy needs to be confirmed prior to receiving Medicaid, and that uninsured or underinsured challenges to getting maternal medical fetal care and long wait times. Maternal fetal medicine is MFM, sorry. And you can see the organizations there to the right that are offering OBGYN provider navigation, and like Sarasota Medical Pregnancy Center is one organization that is able to confirm pregnancies. So let's go down to some additional barriers for prenatal care. Awareness. Many questions about pregnancy, especially during the first trimester and the last trimester. Another barrier was, do folks really understand the risks of not receiving prenatal care or not getting early prenatal care? And then the barrier of, again, not knowing which providers are going to accept their insurance or be able to provide that free or low cost medical care. So what we're doing about it is prenatal education is provided, you can see there, by a number of organizations in our area. Moving on to substance abuse. Lots of barriers. There's fear of being tested because, you know, if DCF or people know that, you know, a parent is using, is that child going to be removed? Will their other children be removed if there's substance abuse? So really want to offer that support, that treatment. And we've got wonderful organizations that are providing case management services, residential inpatient treatment, MAT clinics. The barrier of undocumented families, of course, I know you all know this, there was fear of deportation. There's that language barrier that really gets in the way of accessing prenatal care. So currently, there are organizations offering advocacy and support. And then I believe it's the last barrier for prenatal care is family planning and knowing where people can go to get free family planning resources. Again, we have DOH and Sarasota Medical Pregnancy Center that offer such resources and education. And again, we know that there's more, and we look forward to the conversation this afternoon so that we can fill in some of those holes. So moving on to the second large community indicator, severe maternal morbidity. Again, you can see transportation is a barrier, it being unreliable and or non-existent. Again, the same type of services are being provided by the organizations, the same organizations as prenatal care. Education and awareness, really feeling like there's not a really good awareness about what the warning signs are, what the complications can be that impact severe maternal morbidity. The risk factors are many. Some feel they're ambiguous and they're wide scale. The hospital is providing discharge instructions and OBGYN provider education. when it comes to access to healthcare, again, we go back to the Medicaid issue. And services that are in place are the coordination of postpartum follow-up visits, in-home support and education, and healthcare and hospital coordination. We have a number of different organizations who are all working on these types of services. So we have some good things in place. If you want to, okay. Other barriers, equipment. It was identified that we need free or low-cost medical equipment. And medications for those who have a chronic illness or infections, those medications can be extremely costly. And so the services being provided are free or low-cost blood pressure cuffs or glucometers offered by SMH. Provider knowledge as a barrier. Again, professionals unaware of warning signs of severe maternal morbidity because the risk factors are many. And so services being offered are continuing education, and SMH is participating in a national perinatal collaborative. Healthy food. This is a big one. I know some of the county community health improvement plans are focused on good nutrition, but we need healthy food. There's diet-related comorbidities that can put both moms and babies at risk. WIC offers a lot in this department, diet counseling, and many other things. There's cultural barriers to SMM. We have implicit bias. We have language barriers, a lack of trust of providers. Resilient Retreat does offer trauma-informed care and cultural humility trainings. And then the barrier of stress. Stress can very much impact maternal health outcomes and child outcomes for that matter as well. So we're providing case management support and navigation. And there are a number of organizations, again, in our region that are offering this much needed service. Next slide. So infant mortality, we'll move on to that. The barriers are safe sleep. There is a long list of like sub barriers that could have been grouped together under safe sleep. We have cultural beliefs, intergenerational beliefs, that whole, my mom did it, I survived, I have family that does it, listening to family and just how families have for decades raised their children. Co-sleeping is still happening. A lot of the ads that you see on social media show co-sleep. Some families don't have access to a safe sleep space. They don't have a crib. They don't have a safe place for their child to sleep. And sometimes it's the neighborhood that's not safe. Substance use or parental impairment is another barrier. And then, of course, poverty. Services in our area include the Safe Sleep education. We have the Safe Sleep Initiative. Free cribs and pack and plays are distributed. We have safe sleep training offered by many different organizations listed there on the right. Another barrier when it comes to infant mortality is drownings. So families are moving in. This is a vacation spot. Families are coming into Florida not being familiar with the pools. Sometimes there's not a pool gate around. Distractions can happen so easily, and for that drowning to occur. Some of the services are having swim lessons that are donated to families who may not be able to afford those swim lessons. And then swim safety education is available. Choking, that's another barrier. Really needing to increase parental knowledge about safety and about helping a child, knowing how to help a child if they're choking. And so we do have free CPR training that's offered by SMH and Manatee Department of Health. And the next slide, please. Okay, stress and exhaustion, definitely a barrier for infant mortality. Families oftentimes are moving here. They don't have the family support. They don't have that community. They don't have that village to be able to provide that support. So they're tired. And then if you have an infant that is ill, you know, has colic, that can just add to the stress and the exhaustion. So services available are offering that navigation piece, that social support to reduce that stress. And then Healthy Families, Healthy Start, offering training on soothing techniques and offering various types of support. Moving on to illness and the medically fragile. At risk for infant mortality if there are birth defects. You know, are there congenital anomalies? Are there unvaccinated babies? Again, that difficulty getting to the specialist, transportation, it's a barrier. It's a barrier across all the indicators. And then breastfeeding education and access to baby foods, you know, is that adequate? Services that are being offered for all of this are breastfeeding education and baby food, again, provided by WIC and the hospitals. And then infant dietitian appointments, if the child is underweight, are addressed by WIC. So if you want to go to the next slide. So we are ahead of schedule, which is great. So what is going to happen next is you'll give me a minute and I will set up the breakout rooms. There's going to be 3 breakout rooms. They're going to go by county. So we'll have DeSoto, Manatee, and Sarasota. So we ask that you pick the county that you serve in. If you serve multiple counties and you have more than one staff attending, maybe you could divide and conquer. We really want you to be an active participant. We want you to raise your hand, come off mute, utilize the chat box. We want to make sure that your voice is heard. We know you all, like Kelly said, do amazing work in the community and are a wealth of knowledge. And we really want to pick your brain today and help us create that we can all benefit this inventory of the wonderful things that are going on in our community that can impact these long-term indicators. And not only develop that inventory, but also that will enable us to see where the gaps are. And then we can come back and try to figure out what we can do to fill those holes. And then lastly, at the end of the session, well, actually on the next slide, there's going to be a QR code. If you didn't have a chance to complete the survey and you would like to do so, we would love to have your input. Because you'll be able to, in more detail, provide the information about what your organization is doing in regards to each of these long-term indicators. And it will ask you about like what type of data you're collecting. So that would be very helpful if you would be able to provide that information. And then we're also going to do a follow-up survey, which will give you yet another opportunity to share some ideas. Maybe you had some ahas after the fact, or maybe you learned something new since this meeting and you really want to make sure that it gets included. So there'll be yet another opportunity for you to give input into the matrix. So I think that is it. I'm going to set